I'm Kerry Fink with Helping Seniors of Brevard. It's time for Helping Seniors Updates. Today is Tuesday. Today is the 16th of February, and it's hard to believe we're already in February. But on behalf of Joe Steckler, our president and founder, Rick Broderick, our new executive director, and also Kim Bernard, our education specialist, we have the privilege of welcoming a really, really knowledgeable expert guest to our show today, a longtime friend of the Helping Seniors organization. It's Traci Graf with Avid Home Health Care. How are you doing today, Traci?
I'm doing great. As I told you earlier, I got my first shot
Wow.
yesterday.
And
So
how did that go?
went great. No side effects. My arm isn't even sore. Maybe a little bit tired, but I don't know that it's really related to that. So
Well, that's great to hear. We were talking that Joe Steckler, as you know, he got his shot, and I think his wife Terry has also had her first shot, and everybody has reported all good. So I was thinking, well, when I finally get a shot, I'm ready to get my shot.
yeah. Don't hesitate. That if your opportunity comes, I would jump at it because I know a lot of people are still having trouble getting them and getting registered and finding a place to get them. We have clients asking us all the time if there's anything we can do. I really wish there was, but unfortunately there's really not much we can do except, help them make the appointment if that's what they need, get them to the appointment if that's what they need. We've had people be taken out to Orlando by caregivers for shots. So we can help in that way, but we can't get you any special like up the ladder quickly. So
well, it's all coming, as I gather, a couple of months more, and there will be plenty of vaccine for everybody. So it just seems like we gotta, I keep thinking it like this, Traci. We made it through last year safely by following all the precautions. And I was mentioning that before we started today, is like you were really instrumental in helping us understand a lot of these, because just your whole role of everything you've done in your career, emergency room, all those kind of high-end care nurse things that you've done, you're real familiar with all these. And you said, Kerry, the procedures are basically the same as they have been for any other infectious disease.
yeah, I think that, it's very interesting. I mean, on that note of what the CDC guidelines were and have sort of remained, the social distancing, wearing the masks, not attending group events, things like that, washing your hands more, washing surfaces more. I think people are much more aware of surfaces like doorknobs and buttons and phones and things that technically do carry a lot of germs that, the public didn't really think about before COVID. I do believe that the faster everyone is vaccinated, the better off we're going to be. I know that is not the opinion of everyone. But, for the most part, the medical field understands that these variants that are mutating are happening because we're not vaccinating fast enough. Mm-hmm. I think it was Dr. Fauci who said that a virus that cannot replicate cannot mutate. So, it's the more it spreads in people, the likelier it is to mutate and change. Thankfully, the vaccines we have are effective against the different variants and the mutations, mainly because this vaccine that they've created is it's not made to attack the virus itself. It's actually made to attack a protein that lives on the outside of the virus. So that's the reason why it also is a little different than other vaccines that we've seen in the past, because other vaccines like the flu vaccine, for instance, we guess every year, we make an educated guess on what it's going to do, how it's going to change. And we create a vaccine that we hope will be very close to it and be effective. Flu numbers have been down incredibly, though, because of all of the COVID precautions that people have been taking. But, this is different than that vaccine because we know that protein lives on all of the different mutations or variants, and that the vaccine will attack the protein, not the virus cell. So, but we still need to get people vaccinated faster because, like they're talking about this UK variant that is more contagious. So it is important to get your vaccine as soon as you can. I do think that it's important to talk about a couple of things that I've learned personally, my own self. One thing is some advice that some of my nurse friends have sort of come up with, seeing that a lot of people are having the side effects from the second dose of the vaccine. And I don't know if you've heard that, but it's actually a good thing. It means that our immune system has done sort of a ramping up, like it's getting ready to go into a battle. And that's what the fever and the aches and the chills, that's what that all is. It's our body's immune response to the vaccine. So it's a good sign if it happens. It means that the vaccine that you were given is most likely going to be effective. But we have found that by people taking certain over-the-counter medications within a certain timing of that shot, that we're reducing the symptoms and the side effects that they're having. Oh. And ironically, it actually came out of one of my nurse friends shared with me that they had a lot of call outs from employees who had gotten the second shot. So they developed this little protocol to sort of try to decrease the call outs that were happening from employees getting vaccinated. So they say that you should take Motrin or ibuprofen or Tylenol about 1 hour before you go to have your second shot. You should also take along with it a Zyrtec or a Claritin and a Pepcid. So one of the biggest complaints we see from people with the second shot is that they have a lot of nausea or GI upset. The Pepcid, that you can continue taking that for 24 hours or 48 hours. That will help alleviate that problem. The Tylenol or Motrin or ibuprofen can be taken for up to 48 hours after the shot to, again, help with the fever, chills, aches. And the Claritin or Zyrtec really just helps with any kind of allergic reaction that you might have. Some people get a little bit of a rash, but they seem to think that the combination of those drugs really does help sort of nip those side effects in the bud before they start. So, people can try that if they'd like. They can talk to their doctor about it before they try it if they want. But they're all over the counter, pretty safe medications. So
no, that sounds like it's good things to understand as we all get through this process of getting vaccinated. So that is good. Meanwhile, just before we wrap up on today's Helping Seniors updates, wanted to ask, you guys are open for business, right? You are able to help clients if they are looking for help at home, right? And so
yes, absolutely.
I wanted to ask you about that, and then how folks get in touch with you.
They can call us at 321-392-3400. Someone will always answer the phone. If we don't answer, just leave a message and we'll call you right back. Mm-hmm. But we do have the phone on 24/7.
Wow.
You can call and just ask questions if you'd like, if you're just trying to figure out how an agency like ours could help you. Certainly if you're isolated at home and you don't have help, or you're a single caregiver of a spouse who is, maybe not in the best health, you should probably consider connecting at least with an agency so that if you do need help quickly, you already are established with an agency. So,
yeah. I so want to encourage you, if you're watching this, to give Traci a call. With her background, her experience, her knowledge, just from everything from emergency room to psychiatric care to all sorts of areas that your nursing career has included. You really are a great resource to help us figure out what we need to do best at home. So how do people reach you? What's the phone number and your website?
Our website is www.avidhomecareservices.com, and Avid is spelled A, V as in Victor, I, D as in dog. And our phone number is 321-392-3400.
Okay, one more time on the phone number.
I'm sorry, I talk fast. I'm from Philadelphia. 321-392-3400.
Sounds great. And thank you, Traci, for sharing this information. And we're all looking forward to getting through the COVID world and getting on to bigger and better things. But we've made it this far. And I think it's so important that we do this safely. We get our shots. We still take the precautions as they tell us to. And we just you know, again, we've made it this far. Let's make it the rest of the way through, is what I would say. So,
Agreed.
well, thank you, Tracy, and thank you
Thanks, Eric.
for joining us. We will see you again Friday for the Helping Seniors updates.
Thanks.